small video, I am talking to the medical students of third year and fourth year. And as the topic tells you, the secrets in ophthalmology. I hope that in this live session, I would keep myself to the point and from each chapter will tell you some rules of thumbs and things which you must never forget. Let's start from eyelids. Basal cell carcinoma is in 90% of the patient is present on the lower eyelid. Sebaceous gland carcinoma is almost always present on the upper eyelid from the lids, from the lacrimal system. Uh, in chronic dacryocystitis, the treatment is only surgical, which is called dacryocystoreinostomy. And the principle of this procedure is that we bypass the nasolacrimal duct and make an anastomosis between lacrimal sac and nasal mucosa, thereby bypassing the nasolacrimal duct. Next, conjunctiva. Vernal keratoconjunctivitis is a type 1 hypersensitivity reaction which is present in it is mostly present or exaggerates in summers because of pollens, and it is also called VKC. It has got three types. One is bulbar, one is fornicial or palpebral, and the third is mixed type. Treatment of choice is mast cell stabilizers, but in most of the cases we have to use steroids, but very judicially, wisely. Regarding cornea, normal cornea is always transparent. Any vascularization on the cornea is the symptom of some pathology. And if the on refraction, the axis of the if the patient has a refractive error and the axis is at 90 degree and is increasing progressively, it can be an early sign of keratoconus, which is a disease of the cornea. Regarding glaucoma, primary open glaucoma is usually symptomless and therefore it is regarded as a silent killer. Incidentally, patient is diagnosed and initially peripheral vision is damaged and ultimately the central vision is also affected. It causes irreversible damage to the vision, visual fields, and ultimately visual acuity. Acute congestive glaucoma is the most common presenting stage of angle closure glaucoma, in which all the angle is closed and the patient presents in the eye emergency. 40 or more than 40 or 50 mm of mercury, maybe up to 80 mm of mercury, corneal edema and decreased vision, and it patient has to be admitted. And the other eye, which is normal, must be treated with laser iridotomy. Regarding cataract, is the most important cause of reversible blindness worldwide. The latest technique is phacoemulsification, uh, which is the refined form of extracapsular cataract extraction. Cataract is the most common eye pathology which any eye specialist anywhere in the world ever sees and operates upon. And I don't know the exact figures, but almost 80% of the patients who come to the eye OPD or of surgery, they are for of cataract patients. Regarding uveitis, it is a lingering chronic intraocular inflammation, and main symptoms are seeing the black dots in front of the eyes called floaters. It is treated by steroids. If not properly treated, it may cause complications like secondary cataract formation and damage to the posterior segment. Regarding regarding 90, diabetic retinopathy, 95% of the cases of diagnosed people of diabetes mellitus develop diabetic retinopathy 10 years after the diagnosis, whether it is controlled or otherwise. Control of diabetes may decrease the progression of the retinopathy, but it does not regress it. So every diabetic patient must go for eye screening. Otherwise, it may cause irreversible damage to eye. Hypertensive retinopathy is usually not visual threatening directly, but secondarily due to some blood vessel diseases like central retinal vein occlusion and very rarely central retinal artery occlusion, usually in the younger patient, may cause sudden loss of vision. Permanent in central retinal artery occlusion, but almost totally reversible in central retinal vein occlusion. Regarding retinal detachment, it has got three different types, or it can be divided as rhegmatogenous or non-rhegmatogenous. Means a tear. So in rhegmatogenous retinal detachment, a tear is present and mostly it is present in the supratemporal part of the retina, and mostly it is present in myopic patients in which the eyeball is large, therefore thin, and therefore weak. The other type, fractional retinal detachment, which can occur after many diseases like proliferative stage of diabetic retinopathy or posterior segment trauma. And third one is exudative retinal detachment, which may occur because of some local diseases like posterior scleritis or some systemic diseases like Vogel Koangi, VKH syndrome, or choroidal melanoma, or anything behind the retina. And in the last, when a patient comes with any sort of chemical injury, the first step is to wash the eye with whatever water is available without taking the detailed history for at least 30 minutes, and the rest of the treatment will start after 30 minutes. So in I have tried my here I will stop. I have tried my level best that from each chapter the tips and the important things which are coming right now into my mind to save in this video. So if you watch and listen it a couple of times, you can have a very good concepts. In later days, inshallah, I will try to make some more videos which would be helpful for your preparation to third year and especially for the fourth year who are going to exams and who are the new fourth year in our college or anywhere else. For any questions regarding ophthalmology, please don't hesitate and message me below this video or contact me from any. I will try to get you back as soon as possible. For now, thank you very much and good luck for your studies. Khuda Hafiz. I'm going to close it.